All right, everyone. Welcome. So glad to see you here. Outstanding. Super excited. Another beautiful night. We had a great class last night. The livers and how to rebuild, or the liver and how to rebuild. Now we're dealing with the kidneys and how to rebuild. So it's going to be a great evening. Looking forward to it. If you have not subscribed, please make sure you do so you can ask questions, you can talk, you can do anything that you want. Super excited about you all being here. Again, to be able to watch the full replays, you just have to join the Patreon. You can join at a tier of actually YouTube viewer and above. We got a 7-day free trial, so make sure that you get over there and get that. While you can get it, you have an opportunity to do so. I'll be dropping the links to everything below as well. Also, if you need, if you have a serious issue and you need a consultation or anything like that, you can get a free consultation. I'll be dropping the link in for that as well. And also, that's pretty much what we're going to be promoting today. And so a free consultation is really good. I get you the information. I go through everything going on with you, and I put forth my recommendations and are able to help you. So if you have an issue with your kidney, you have an issue with your liver, you have diabetes, you have cancer, you have high blood pressure, stroke, anything like that, you let me know. I personally had a heart attack. I did not go to the hospital. I healed myself. And in doing so, made all the difference in the world for me. And I was being able to help others from that. And we've been growing. We've been helping. We got testimonials. We have everything to prove that we've allowed I've helped people to allow their bodies to heal itself. And as well as I can show you exactly the same, and then you can do it. My goal is not to keep you forever. My goal is to actually be able to make it where you don't need me anymore. You're always welcome to my classes. You're always welcome to everything that I do. And if you need me, you're always welcome to reach out for me as far as starting a service or something like that. However, my goal is to make sure that you do not need me for the same ailment over and over again. And prayerfully, if you do what I say, you won't ever need me again. So that's going to be great. So with that, I have to play the disclaimer, and then we will move right into the class.
Disclaimer. The information contained in this video is intended as an information resource only and is not to be used or relied upon for any diagnostic or treatment purposes. The video's information does not create any patient-physician relationship. Dawid Yisrael makes no representations about the accuracy or ability of this content, as scientific and medical information updates and changes daily as more substantial information is discovered. Dawid Yisrael and any business associated during this video shall not in any event be liable for any direct or indirect damages, losses, injuries, or liability whatsoever suffered as a result of your use or misuse of this video's content. Use of this video is at the viewer's sole risk.
Hi, Isola here. I just want to thank Brother Dr. Wonderful health presentation today, and it just reinforced the knowledge that I already knew, that let food be thy medicine, okay? And if you are facing a challenge or you want to change your diet or lifestyles, make sure you take one of his upcoming program events.
All right. Shalom, Jerry. Welcome to the call. Glad you're here. Glad to see you. Outstanding. Right? And we're talking about how to rebuild your kidney, so we're going to jump right in. So one of the main things that we need to understand is that the medical industry actually normally tells people that they cannot rebuild their kidneys. As a matter of fact, we've had people that have been in the hospital stating that their kidneys were damaged or something like that, and the doctors told them there's nothing we can do for it. And we were blessed. Our team was able to get their kidney functioning all the way from, no matter where it's at, I've seen it all the way down to 3, back up to functionality, and then move it towards 100%. So your kidney definitely can be rebuilt, or functionality can be returned to your kidney rather, up to 100%. And I'm going to prove that tonight. And so by the end of this evening, you'll be able to see that information. Okay, so we're going to start off with what is the kidney. Okay, so most people, I want you to the thing about me, like I said, I'll make it where you're not going to need me in the future. right? I'm giving you the information that is necessary for you not to need me in the long run. You're only going to need me for a short period of time, more than likely, okay? So the kidneys are a pair of organs that filter blood, remove waste, and produce urine, okay? The kidneys are located in the upper abdomen, one on each side of the spine, just below the rib cage. All right, so the upper back. A lot of people have lower back pain and they think that it's dealing with the kidneys. It's not. Your kidneys or problem is going to always be the upper back, not lower back. Okay, so usually lower back is back pain. Upper back is kidney issues. Okay, I want you all to be very clear on that. Now, the kidneys are bean shaped and reddish brown in color. Each kidney is about the size of a clenched fist. So if you clench your fist, your kidneys are going to be about that size. All right. Now, function. Kidneys filter blood, removing waste and extra water to produce urine. They also regulate the amount of salt, water, and other chemicals in the body. Kidneys also produce hormones that help control blood pressure, make red blood cells, and keep the bones strong. Kidneys are made up of several tissues, including the medulla, the nephrons, the renal pelvis, and the renal ileum. Urinary tract. Kidneys, uterus, and bladder are part of the urinary tract, right? Urine flows up from the kidneys to the bladder through two thin tubes of muscle called ureters. Kidney function. Kidney function declines with age and injury. I totally disagree with age. Whenever they say something declines with age, it's not because of age, it's because of what you're putting in the body over the years, and that pulls down or makes it decline. Not age. Age has nothing to do with death. And if you go back and watch my video on Patreon with the what is that? The Patreon with the what am I looking for? The words I'm looking for. Oh yeah, with physical immortality. So the video on physical immortality, if you look at that video, you're going to see that I show you where the scientists and doctors will tell you that life or age has nothing to do with aging. Nothing at all. As a matter of fact, it's impossible for you to die from old age. That's impossible. There's always a proximal cause. And a proximal cause is diabetes, high blood pressure, cancer, stroke. Those type of things are proximal issues. A tree falling on you or something like that. So you cannot die from old age. So if you keep your body in the proper live-it, if you're eating your optimum live-it and you keep your body in shape and you follow the lifestyle that you're supposed to follow, you actually have no reason to die. That's the truth of the matter. That's scientifically proven. That's not me just talking. That's scientifically proven. So go, if you're not a part of my Patreon, join the Patreon, patreon.com/health class, all one word, no spaces. Patreon.com/health class, and watch that video. It's extremely powerful. All right. So kidneys are bean shaped and reddish brown in color. Each kidney is about the size of a clenched fist, as we stated. Kidney function declines with age, and injury or disease can damage the kidneys. Now, injury and disease can damage the kidneys. That is true. All right, but age doesn't have nothing to do with it. It's disease caused by what you've been putting in the body over years, so they'll call that aging or dealing with age, but it's not. Okay? As a matter of fact, if you understand acute kidney disease, it can just show up out of the blue, out of nowhere, but you've just been building it up over time. So, or you can injure it, right, and cause that issue immediately, all right? So I want you to be very clear on that. Now, kidney. Most people have two kidneys, organs that sit in the back of your abdomen. Your kidney's primary function is to filter your blood. That's how important it is. That is extremely important. So if your kidneys aren't functioning properly, they will not filter your blood properly. That is a major issue. Right? Because the blood is the life. Never forget that. The blood is the life. They also remove waste and balance your body's fluids. So they balance your body's fluids, right? They balance the electrolytes and they remove waste. Common kidney conditions include kidney disease, kidney infections, and kidney cysts. Okay? The kidneys are two bean-shaped organs that filter your blood. Your kidneys are part of your urinary system. Your kidneys filter about 200 quarts of fluid every day, enough to fill a large bathtub. During this process, your kidneys remove waste, which leaves your body as urine or pee. Most people pee about 2 quarts daily. Okay? Only 2 quarts, rather. Excuse me, 2 quarts daily. Your body reuses the other 198 quarts of fluid. All right? So you usually urinate about 2 quarts. The rest of it goes back into the body and has been filtered. You're peeing out what has been filtered. Okay? Your kidneys also help balance your body's fluids, mostly water and electrolytes. Electrolytes are essential minerals that include sodium and potassium, okay? So you want to be able to balance your electrolytes, okay? So a lot of times potassium and phosphorus are major issues with somebody that has any type of kidney issue, okay? So it's very important to understand that, especially when it comes to eating and so forth, which we'll talk about in a little bit. So people with diabetes or high blood pressure have the highest risk of kidney problems. So diabetes and high blood pressure do what? Attack the kidney. But why? Because those medications that they give you destroy the kidney. So high blood pressure medicine attacks the kidney. Diabetic medication attacks the kidney. Right? What regulates your blood pressure? Your kidneys. So if the blood pressure medicine is destroying the kidney, this is why you're seeing so many people on dialysis today. So that's why we try to get you off that high blood pressure medicine or diabetic medicine ASAP, because they're going to hurt you. That's why if you watch the video I just did called The Magic Pill, which is on YouTube, you can watch the full video. It's a public video. I did one called The Magic Pill. On that video, I show you all the side effects that these medications have. Actually, I don't show you. I allow them to show you on their own. And I'm going to do another one because I want to go deep into that. Accidents or trauma can also harm your kidneys, such as car accidents or sports injuries. Okay, so you want to be very careful with that, because kidneys handle everything. Like you need your kidneys. It's not something to play with. So your kidneys have many important functions. They clean toxins and waste out of your blood, and that's why you have 2 kidneys. You actually have 2 kidneys because they are that important. They clean toxins and waste out of your blood. Common waste products include nitrogen waste, urea, muscle waste, creatine, and acids. They help your body remove these substances. Your kidneys filter out about half a cup of blood every minute. Blood flows into your kidneys through a large blood vessel called the renal artery. Tiny blood vessels in your kidney filter out blood. The filtered blood returns to your bloodstream through a large vessel called the renal vein. Okay? Pee travels through tubes of muscles and called ureters to your bladder. Your bladder stores pee until you release it through urination, peeing. Okay? So this is the 5-step process. So blood flows into your kidneys. Then tiny blood vessels in your kidneys, they filter the blood. The filtered blood returns to your bloodstream through a large vessel called the renal vein. Pee travels through the muscle, right, called ureters, to your bladder. And your bladder stores pee until you release it through urination. This is why when we have a bladder issue, right, or a prostate issue or anything like that, this causes major problems. Now we got backup. The kidneys also control the acid-base balance, pH balance of your blood. They make sugar glucose if your blood doesn't have enough sugar. So they produce what? Food. So the kidneys produce food. This is extremely important to get for the body. Okay? Make a protein called renin that increases blood pressure. Produce the hormones calcitriol and erythropoietin, excuse me for that. Calcitriol is a form of vitamin D that helps your body absorb calcium. The other helps your body make red blood cells. This is extremely important, right? So if you're anemic, could have an issue with your kidneys. Okay? Now, An adrenal gland sits on top of each kidney. It produces hormones, including cortisol, which helps your body respond to stress. Now, how do my kidneys filter blood? Each kidney contains more than 1 million filtering units called nephrons. And each nephron consists of glomeruli. Glomeruli are groups of tiny blood vessels that perform the first stage of filtering your blood. They then pass filtered substances to the renal tubules. The name for this process is called glomerular filtration. Renal tubules. These tiny tubes reabsorb and return water, nutrients, and minerals to your body needs, including sodium and potassium. The tubules remove waste, including excess acid and fluids, through a process called diffusion. Your body sends the remaining waste through your kidneys collecting chambers. Eventually, it leaves your body as you pee. Can you live without a kidney? You can live with just one kidney. That's why you have two, like I said. Healthcare providers can remove one of your kidneys in radical nephrectomy, okay? So we don't want that. We don't ever want that to happen, right? We want to rebuild the kidneys. We don't want to remove the kidneys, okay? But medicine today is about removing, cutting you up, and giving you medicine. That's it. Those are the two things they're going to 99.9% do, right? So someone may have only one kidney if they had a kidney removed during cancer or injury, made a kidney donation to someone else for a kidney transplant, were born with only one kidney, or were born with two kidneys but only one kidney works, okay? Where are your kidneys located? You can see it here, right? The adrenals are above it. I'm going to do a video on adrenal. These are so important, it's ridiculous. Your adrenals are ridiculously important. But I'm going to do that later, okay? So the kidneys land right here. That's why I said it'll be in your upper back where you're going to feel the pain, not the lower back. Okay? The upper back is where your kidneys are at. Typically, one kidney sits on either side of your spine. Your kidneys reside between your intestines and diaphragm. A ureter connects the kidney to your bladder, right? Ureter here. Now, what are the parts of the kidney? All right, I'm not going to go through the parts of the kidney as much right now. We're going to skip that. What color are your kidneys? Your kidneys are reddish brown. How big is each kidney? Each kidney is 4 or 5 inches long. Like we said, about the size of a fist. How much do your kidneys weigh? The weight of your kidney varies. Variances might include your height, weight, age, body mass index, and location. For men and people assigned male at birth, your right kidney can range from 1/5 to about 1/2 pounds, 79 grams to 223 grams. Your left kidney may range from a little less of 1/5 to more than 1/2 pounds, 74 to 235 grams. Your kidneys may weigh between the weight of 1 tennis ball and 4 tennis balls. For women and people assigned female at birth, your right kidney may range a little more than 1/10 to 3/5 pounds, which means they can be heavier. They can be lighter and they can be heavier than a man's. So 55 grams to 274 grams, your left kidney may range from 320 to 3/5 of a pound, right? 3/20 to 3/5 of a pound. 67 grams to 261 grams. Your kidneys may weigh between the weight of 1 tennis ball to 5 tennis balls. Okay? Your kidneys perform several important functions within your body. Many different disorders can affect them. Common conditions that impact your kidneys include chronic kidney disease, right? They call it CKD. May lessen your kidney function. Diabetes or high blood pressure usually causes CKD. Kidney cancer, renal cell carcinoma, right? Always carcinogens rather, right? Always are going to create this. So renal cell carcinoma is the most common type of kidney cancer. Kidney failure is renal failure. Kidney failure may be acute and worsen suddenly, or chronic, a permanent lessening of how well your kidneys work. Sorry about that. Did not mean to do that. End-stage renal disease is a complete loss of kidney function. It requires dialysis. No, it doesn't. No, it doesn't. Right? We can reverse that without dialysis. You do not have to get on dialysis. And this is very important because once you are on dialysis, it can be very difficult to get you off of it. All right? Kidney infection. A kidney infection can occur if bacteria enter your kidneys by traveling up your ureters. These infections cause sudden symptoms. Healthcare providers treat them with antibiotics. Kidney stones. Kidney stones cause crystals to form in your urine and may block urine flow. Sometimes these stones pass on their own. In other cases, healthcare providers can offer treatment to break them up or remove them. Now, kidney stones come from what? Oxalates. This is why we don't deal with the dark leafy greens, right? Or anything with massive cellulose, because they have high oxalate content. Okay? We don't want that. That causes kidney stones, right? Sometimes these stones pass on their own. In other cases, health providers can offer treatment to break them up or remove them. It's one of the most painful things you will ever go through in your life if you end up having kidney stones. So we want to stay away from that. Also, oils can do it. Eating vegetable oil, stuff cooked in oils, any type of oil, can cause kidney stones. All right. Kidney renal cysts. Fluid-filled sacs called kidney cysts grow on your kidneys. These cysts can cause kidney damage. Okay. Polycystic kidney disease causes cysts to form on your kidneys. PKD is a genetic condition. It's eating disorder. It may lead to high blood pressure and kidney failure. Well, now countless other disorders can affect your kidneys. You see, you're going to find almost every illness that you have is going to affect your kidneys. This is why we want to remove all disease from the body, right? Acidosis. Excess acid accumulates in your kidneys, which may cause many health problems. It can be life-threatening. Acute or interstitial nephritis. Your kidneys become inflamed, sometimes after exposure to certain antibiotics, which may lead to kidney failure. Azotemia. Nitrogen waste builds up in your kidneys without treatment. Azotemia might be fatal. Cholestasis. Excess fluid causes your calyxes, where urine collects, begins to swell without treatment. Cholestasis may result in kidney failure. Diabetes related neuropathy or hypertensive nephropathy. Unmanaged diabetes or clinically high blood pressure causes kidney damage. Glomerular diseases cause inflammation to damage your glomerule, right? Minimal change disease and nephrotic syndrome. Minimal change disease and nephrotic syndrome causes kidneys to release the excess protein in your pee. Papillary necrosis. Chunks of kidney tissue die in the medulla and the papilla. The tissue can break off and clog your kidneys, leading to kidney failure. Proteinuria means you have high levels of protein in your kidneys. It can be a sign of kidney damage. Pyelonephritis. This sudden kidney infection causes edema, swelling in your kidneys. It can be life-threatening. And uremia. Toxins that normally leave your body through pee and end up in your bloodstream. Now, what are the first symptoms that show up? Okay, cramping muscles, number one. Electrolyte imbalances cause your muscles to stiffen. Dark urine with blood in it. Damage to your kidneys filters lets blood cells leak into your urine. Foamy urine. Bubbles in your pee can signal excess protein. Itchy, dry skin. An imbalance of minerals and nutrients in your blood leads to itchy skin. More frequent urination. Problems filtering waste you to pee more often. Puffy eyes and swollen ankles and feet. Right? Reduced kidney function can cause your body to hold on to protein and sodium, resulting in swelling. Sleep problems, fatigue, and lack of appetite. If toxins build up in your blood, your sleep, appetite, and energy levels might be off. All right? So that is key. All right? So that's basically the kidney. Now, the question is, how do we get the kidney back in functionality? So now what we're going to talk about is how to heal the kidneys, okay? And more videos like these, you can join us at patreon.com/health class. Again, that's patreon.com/health class. And join one of our paid tiers. Any of them will do. And you join one of those tiers, you can watch the rest of these videos, as well as all the other videos that I produced, including my former health classes, which is 4 to 8 hours of information that can help you on your health journey to the top. All right. So I look forward to sharing that adventure with you. I look forward to seeing you at the top of your health journey.
Peace.